And we're talking about tactics. Of course, all this is in the context of mental health. What about the formulation of the policy? I'm sure we're going to hear something about that from the chief executive, but the formulation of the policy must be interactive. There are numerous stakeholders when you are concerned with mental health. And I'm sure the writers of this policy and made sure that they consulted those who are appropriate. The need for the policy. We know that in our everyday lives, if we did not have rules, there will be chaos. We also know that often makes reference to it. We also have the constitutional basis for what we are here for today. And that can be found in the directive principles of state policy. What normally comes first? Is it policy before the law or the law before policy? That is quite an intriguing subject in itself. Most oftentimes, it's the policy before the law. But as I always say, as a teacher in my subject area, there are always exceptions to a rule. And sometimes it is the law that gives birth to policy. And indeed, there are examples of that in our jurisdiction. So what does the policy set out? I know we'll be hearing more about that, but I just want us to think about the following. The policy sets out what is to be done. The policy sets out who is to do it. The policy sets out how it must be done. It also sets out with what it must be done. The policy sets out when it must be done. The policy sets out how it must be evaluated. It also sets out who will review it. And finally, amongst other things, it also should set out when it will be revised. I'm looking forward to hearing about what is in the mental health policy. Mental health is a subject that is very, very close to my heart. Some of you in this room are very much aware why it is close to my heart. And I'm so glad that the mental health policy will complete what is required to move mental health forward in this country. We now have the Mental Health Act. That in itself was a very, very major achievement for which we must give credit to the chief executive. Can we please clap for him? Apart from the Mental Health Act, which was quite an innovation and is stellar in the international context, we can now boast that we have mental health regulations. What completes the trilogy is a mental health policy. So with these three important milestones achieved, we should be prepared to move forward to ensure that the best interests of the mental health of the people in this country is assured. Thank you very much.
Thank you very much, Madam Chair. And let's do it for her as we go back to her seat, please. Thank you. Thanks so much. Actually revealing to us the importance of having a policy and again, why we are here today. I think there's a major milestone in the history, in the story of mental health in Ghana, and we are happy to be a part of this. Well, so I think probably just to quickly introduce or acknowledge the presence of some dignitaries that we have here with us. We do have the Deputy Chief Executive of the Mental Health Authority in the person of Dr. Caroline Amisa. She's here with us. Dr. Amisa, please give us a word. Thank you. Again, from the World Health Organization, we have Madam Rosalind Doe. Thank you so much, ma'am, for coming. Thank you. And for the people who have supported the uptake of this program for a very long time, we've had a mental health policy, but we've not had the opportunity to launch it like we're doing today. And there is this body, Ghana SomubieDwumadie, that is supporting us do this today. So what you see here is by the support of Ghana SomubieDwumadie. And we have the team leader of this organization here, and she is Madam Lila Adwan. Lila, please give us a wave. Thank you. Thanks so much. And thank you for supporting this very program. We appreciate it. Again, I'd like to recognize the presence of all directors from the Mental Health Authority. If you are here, please give us a wave. Let's see you, directors of the Mental Health Authority. Thank you very much. Thank you for coming. And then from Basic Needs Ghana, we have Mr. Sunday and our representative. Mr. Sunday, give us a wave. Thank you very much. We have representatives from the Pharmacy Council, from Pantan Hospital, and then we have a former member of the Mental Health Board, Mr. Owusu-Ansah. He is here with us. Mr. Owusu-Ansah, give us a wave, please. And thank you very much for coming. He's never, left us in the dark. Whenever the Mental Health Authority has a program, you are sure to see Mr. Owusu-Ansah there. We appreciate it. Again, from the Ghana Health Service, we have Dr. Samuel Kaba, and Dr. Kaba is here. Dr. Kaba, please give us a wave. Thank you. And then from Johnson & Johnson, Caroline. Is Caroline here? Thank you. Thanks, Caroline, for coming. We appreciate that. Again, from the NCCE, Ruth Bwampon is here, right? Ruth, thank you so much. Over there at the back there. Right. And we have representatives from the Nurses and Midwifery Council. Thank you all for coming. Give us a wave if you are here. Right. And then from Allied Health Profession, from Allied Health. Do we have representatives from Allied Health? We do. Thank you so much for coming. It's also important to acknowledge the presence of my colleagues, the media, and I see them at the back there and all over. Give us a wave, those of you at the back there. Thank you so much. Thank you. And just to let you know, this program is also on Zoom. It's being carried live, so we have quite a number of people joining us on Zoom. And we want to acknowledge their presence and thank them for joining us. So I want to, at this time, call on the Deputy Chief Executive of the Mental Health Authority, Dr. Caroline Amisa, to give us a welcome address and the purpose and objective for this meeting. Dr. Amisa, please. Thank you so much.
Thank you very much, Mr. Broby, and good morning again to all of us. Madam Chair, members of the High Table, representatives from FCDO, that's the Foreign, Commonwealth and Development Office, WHO, directors of Mental Health Authority and the Ghana Health Service, other representatives from the ministries, departments and agencies here gathered, our media friends, and all distinguished persons here invited. I am privileged to welcome you on behalf of the Ministry of Health to the launch of our mental health policy for Ghana. I acknowledge your presence here this morning, and I'm happy that you've been able to take time off your busy schedules to join us to mark this very important occasion. You're welcome. I'd like to say that our first mental health policy, for Ghana, was developed in 1994 and revised in 1996. And since then, that is what we have been using. And whether we were able to implement it very well or not, a lot happened in the global, national, and even the local mental health landscape. And that culminated in the development of an act, like Madam Chair referred to, in 2012. That's Mental Health Act 846. And our very latest regulations, the LI 2385, just about 2 years ago. And with the passage of the act came the establishment of the Mental Health Authority. And the authority had the responsibility and still is responsible for overseeing mental health services in Ghana. As part of our mandate, we are to propose and ensure the implementation of policies for the ministry or to the ministry, and then it is adopted, and then it becomes a document for all of us to work with. And I think Madam Chair mentioned sometimes policies come before the acts and all that. In our case, we've had our acts, we've had the LI, and today we are here to look at the policy, which maps out the framework within which we can implement the act, etc. So far, the policy that we have developed takes into consideration all sectors of health and outside health. So we have collaborations with various stakeholders, and you will see that the people in this room are varied. There are different stakeholders here. We are not all health persons here. Some are coming from different ministries, different sectors within Ghana. We see mental health as something that is very important for the nation, because a healthy nation means what? A wealthy nation. And we know that you cannot be healthy if you are not mentally healthy. So we say mental health is total health. And we are very happy that as a country, it is an important indicator. That's our mental health status is an important indicator for us to determine whether we are healthy or not. I will not talk much. There'll be a presentation on what the policy entails, but I'll say that the current focus of mental health in Ghana is community care. It's community oriented. So the policy gives us the new direction for how to improve mental health services outside our facilities or our institutions, bringing it to the doorstep of the people of Ghana. And this morning, as we gather here, I will implore all of us to embrace this policy. You will see yourself in there, trust me. When it's outdoor, then you see it. It's a beautiful document, and it gives you actually all the details of what you need to do, how you need to do it, who has to do what. It's all in there. It's already been mentioned. So I will not bore you. All I would like to say is that I entreat us to embrace it and help us to support the direction, the new direction that we want to take mental health to, and the level to which we want to take mental health. We ask that as you leave here, you become ambassadors for mental health and make sure that Ghana is indeed a wealthy nation or becomes a wealthy nation. Thank you very much.
Thank you very much, Dr. Amisa. Please give it up for her. She takes her seat. Yes, definitely. I mean, I'm sure all present here agree that we will embrace this policy and make mental health in Ghana better. Next on my program, I need to call up some few people who are here with us to give us some solidarity messages. Of course, they are stakeholders in mental health, so definitely we need to hear from them on an occasion like this. But before I do that, I'd still want to acknowledge the presence of some few other people I'm seeing here. The director of the Anchor Psychiatric Hospital is here with us. Dr. Kojo Obeng, please give us a wave, Dr. Obeng. Thank you so much for coming all the way from Anchor down here for this program. We appreciate it. And again, our colleagues from the Ghana Federation of Traditional Medicine are here with us. GAFTROM, thank you very much. We really appreciate your presence. And I'll continue to acknowledge the presence of persons here with us as and when you catch my eyes, please. So now to our solidarity messages. And I want to take off by calling the representative from the Foreign Commonwealth and Development Office, FCDO, to give us a short solidarity message. Please welcome her.
Good morning. Good morning, Madam Chair, members of the High Table, ladies and gentlemen, members of the press, all protocols observed. It is my pleasure to join you today to represent the Foreign Commonwealth and Development Office at the launch of the new 12-year mental health policy. The UK has been a proud supporter of mental health in Ghana for over 10 years. Through the Ghana SomubieDwumadie program, we work in partnership with the Ministry of Health, the Mental Health Authority, Ghana Health Services, and a consortium of NGOs, including CHAG and Basic Needs. People with mental health conditions are often left behind by development. This has worsened with the COVID pandemic. In many low and middle income countries, such as Ghana, people with psychosocial disabilities have little control over their own lives and very few opportunities to take a stand against stigma, discrimination, and abuse. The FCDO recognizes that people with mental health conditions are among some of the most vulnerable in Ghana. Therefore, we sought to provide around £12 million to Ghana SomubieDwumadie to support 4 key areas of change: promoting stronger policies and systems, scaling up high quality and accessible mental health services, reducing stigma and discrimination, and generating evidence to inform policy and practice. With FCDO support, Ghana SomubieDwumadie have made significant achievements in 2020. These include providing 7 fast-track COVID psychosocial resilience grants to reach around 4,000 people, the reopening of 171 self-help groups in Ghana, training 131 mental health care workers in COVID-19 and mental well-being, providing COVID readiness assessments at psychiatric hospitals, reviewing the supply of psychotropic medicines, and building an investment case for mental health. Ladies and gentlemen, it is critical and timely to invest in mental health, particularly during COVID. I would therefore urge the government to take action to secure sustainable funding for mental health. The new mental health policy calls for increased investment into mental health. Funds are urgently needed to implement mental health legislation and the mental health policy, as well as to enable the Mental Health Authority to fulfill its mandate. Furthermore, scaling up quality mental health services at the community level equitably across the country, including all the regions, is currently underserved, and this is also a critical area. In addition, with FCDO's support, I will call on the government to invest more resources in tackling stigma and discrimination, and to support the full, active inclusion of people with mental health conditions. Ladies and gentlemen, members of the press, finally, I'd like to conclude by congratulating the Ministry of Health, the Mental Health Authority, and all stakeholders involved in the launching of this mental health policy. This moment provides an ideal opportunity for the government to provide investment for sustainable mental health systems and an opportunity to integrate mental health as a core part of our COVID response. This includes ensuring equity in terms of access to COVID vaccines for the vulnerable, including people with mental health conditions. To build back better means improving primary health care so that it's closer to the community, which will help strengthen societal resilience in the future. Thank you very much.
Ladies and gentlemen, the Foreign Commonwealth and Development Office, and thank you so much. I think we all do see that they're really in here to support mental health development in Ghana, and we really appreciate this gesture. So before I call up the next stakeholder here to help us with our solidarity messages, just give me a minute of, I'll do a minute of consultation, please. Take it as a commercial break, please. Okay, ladies and gentlemen, thank you. Back from our commercial break. And I did indicate that we had a representative for the Minister for Health, and we are fortunate to have him here. He is the Chief Director of the Ministry of Health and is in the person of Untitled Chapter. Sir, you're very welcome. Thank you so much for coming. Thank you. Thanks so much. We'll call you up here at the appropriate times to deliver what you have for us from the minister for us. Thank you. Thanks very much. Okay, so back to our program again. I think I want to call on the representative from WHO to give us a short message. Please let's welcome her with a clap.
Thank you very much. And good morning, everybody. Madam Chair, Chief Director, Ministry of Health, representing the Honorable Minister of Health, the CEO of the Mental Health Authority, and all directors here present, representatives from Ghana Health Service and other agencies of the Ministry of Health, development partners, our dear friends from the media, distinguished ladies and gentlemen. On behalf of the WHO country representative for Ghana, Dr. Francis Kasolu, who had planned to be here, but unfortunately is engaged in another competing assignment, I bring you very warm greetings from the World Health Organization, Ghana Country Office. A lot has already been said about the state of mental health in the country and the need for investment, so I won't belabor that point. And I like the way the MC stressed a short statement, so I will comply. But as we all know, developing a mental health service of good quality requires the use of evidence-based protocols and practices, including early intervention, incorporation of human rights principles, respect for individual autonomy, the protection of people's dignity, and improving access to care. This requires that any country has a policy document that outlines the direction that these services or these needs must be made. The policy document outlines the needed strategies and systems for achieving the vision of the authority for the well-being of the Ghanaian populace. WHO therefore congratulates the Mental Health Authority and the Ministry of Health on this great achievement and is pleased to be part of this policy launch. We believe this policy will provide direction for mental health services in Ghana and will facilitate the global agenda of emphasizing community mental health and holistic care that respects the human rights of providers and service users. The World Health Organization has collaborated on several projects in mental health with the Ministry of Health through its agencies, the Mental Health Authority and the Ghana Health Service. The current project being the WHO Quality Rights Initiative, which was launched in Ghana in 2018. We wish the Mental Health Authority of Ghana a successful launch, and we are confident that you will lead the implementation of the policies and strategic directions that are incorporated in this document, and that we believe will also lead to the closing of the mental health treatment gap that we currently have. This is in line with the Sustainable Development Goal 3, which focuses on ensuring healthy lives and promoting well-being for all ages. Once again, we say congratulations to the Mental Health Authority and the Ministry of Health, and we wish you a very successful launch. Thank you very much.
Madam Roslyn Doe of the WHO, ladies and gentlemen, thank you very much. And thank you for complying with our short message rule. Thank you. You know, in these days of COVID, you don't want to keep people in a room for a very long time. So yes, right. Okay, let me call up from the Ghana Health Service, the Director ICD, Dr. Samuel Kaba, will give us a very short message. Dr. Kaba, please. Well, I mean, Dr. Kaba, I have worked with him for a very long time, and I know he's usually very brief, so expect a short one.
Thank you so very much, MC. Good morning, everybody. I think you just made a mistake. You can't call a gent and say it should be short. It's a Ghana Health Service, and then you expect us to be short. So I'll do my best to be as short as possible. However, you wanted to hold for me. It's my characteristics. You know, and the point is that when I was younger, I could read like this, but I'm so sorry. Anyway, thank you so much, MC. Mr. Chairman, the rep of the Honorable Minister, all dignitaries of the high table, organizers of this special event, distinguished ladies and gentlemen, and that includes our partners, the media, and all present here today. I say to you, good morning. I stand before you representing the Director General of Ghana Health Service. I am graciously humbled to be here with you and consider it an absolute privilege for the opportunity to address this noble gathering. Our sincere gratitude to the organizers and especially the host, Professor Agresios, for his warm reception when we came in this morning. I also congratulate him for becoming a professor. I think we should clap for him. Mr. Chairman, to put things into context about what I'm going to say, permit me to quote the following. History is more than the path drawn by the past. It influences the present and can shape the future. Ghana Health Service has inextricable links with Mental Health Authority. And the Director General has not only sent me here to express his congratulations, but also to pledge our solemn obligation to closely collaborate with Mental Health Authority to implement this policy at all levels of the service delivery to the benefit of all Ghanaians in our beloved country. Mr. Chairman, it is morning again in Ghana. Thousands of people will go to our hospitals nationwide for medical service. Some may survive, very sad as it may, some may die. Some may be cured, and some will get worse. Some will be happy with our services, and some will be furious about the way they get treated. Whatever happens, you and I, we are responsible to make things better and give smile of hope to the needy and the sick. The needy and the sick, sorry. To this, we have come so far. We have seen so much, but I say to you, we have more work to do for mental health, which is a disease of the silent majority worldwide, and that includes Ghana. We now know that 1 in every 5 adults is affected, and 1 in every 10 children is affected. So the silent majority is referred to us, we the people, both the working class and the unemployed. That child whose eating habit has changed and we don't pay attention. The man who lost his job, or that woman who delivered and is suffering and is depressed of Sheehan syndrome, or simply that worker who comes late every day to work without us listening to his or her story, but keep blaming her and making the workplace a difficult place for him or her. Or the couple struggling with marital issues, with divorce and depression. Mr. Chairman, Nassim Nicholas Taleb talks about the power of failure in his book entitled Anti-Fragile, things that gain from disorder. While resilience is the ability to resist shock and remain the same, anti-fragility is about the ability to grow stronger and even thrive as the result of shock, stress, and disorder. Anti-fragility teaches us to value and use the friction of crisis and challenge, because that is where we can grow. This policy has therefore arrived at the appropriate time when the entire world is suffering a pandemic of our generation that needs the inclusion of every individual, male, female, able, disabled, rich, poor, the young and the not so young, irrespective of your tribe, religion, party, or color of your skin. All of us, because our nation and the world cannot be free if even one human being is left behind. Humanity is one, and that is a great lesson we should all learn from COVID-19. We must be each other's keeper if we all want to have safety and have back our livelihoods. Mr. Chairman, Rep of the Honorable Minister, dignitaries present, and fellow Ghanaians, if I'm also allowed to say so, fellow Ghanaians. We in Ghana Health Service have collaborated with mental health institutions for no one to be left behind. Pantan Hospital has played a significant role. Many who thought were normal suffered various degrees of depression for the simple fact that they had acquired COVID-19 disease. Depression and stigmatization set in. We are all fragile and potential mental health patients. We therefore deploy brave men and women, nurses, doctors, clinical psychologists, all of them from the mental health fraternity into the front line of our fight against COVID-19, providing various forms of psychotherapy to patients and relatives. We have trained community mental health practitioners to support the activities at the regional, district, and sub-district level. Based on the principles of promoting total quality health, being the prevention of disease, curative rehabilitation, or palliative care, Ghana Health Service is establishing mental health wings in all regional and district hospitals. Through the chiefs, we are extending services to households as we embark on the policy of people, family, and community-centered care, championing mental health as part of our core business. In doing so, we also want to guarantee the well-being of our workers by implementing the Employee Assistance Program, Joy at Work, and insurance of health staff. This will boost the confidence of our health workers to enable them to deliver quality care. When people need you, the minimum is to assure them that you care and shall be there for them, and that is exactly what we are doing. The service is engaging clinical psychologists, community mental health nurses, mental health physicians, assistants, and supporting the Ghana College of Physicians and Surgeons to train more psychiatrists. We recently concluded an intervention in collaboration with GIZ to salvage people who inject themselves with hard drugs, substance abuse, including tramadol and alcohol. And as stated by the rep of WHO, we're also doing activity on the quality rise of people with mental health disabilities. The school screening program will help us to detect children with mental health sickness, including eating disorders and some home abuse. Wellness clinics will support geriatrics, old age, and non-communicable diseases. Mr. Chairman, I remember being part of the first board of Mental Health Authority. I understand the depth of demands and challenges of such a newly created and very unique authority. I also happen to lead and supervise the activities of mental health in Ghana Health Service as the Department of Mental Health is under institutional care, which I lead. So this is the issue, representative of Honorable Minister, and I'm happy you are the Chief Director. You know, when you have 20 Ghana cedis in your account, and you believe that that is a lot of money, that you can buy food for your family, you can rent a house, you can finish the accommodation. You believe that with this amount, you can buy a car and feed your family plus chop money every day. But then you sit to do a realistic budget. You realize that even the amount is not enough for feeding, left alone for the rest of the other needs and wants. That is the daily experience of mental health. Lot of responsibility, but little funds. So we join our voice to advocate for more resources for mental health through all means. Fellow citizens, government can do its best, but cannot do everything alone. We call on everyone, philanthropists, the private sector, in their corporate social responsibility, donor partners, NGOs, CSOs, traditional and opinion leaders to extend a helping hand to mental health. In the life of every generation, the spirit of that sacrifice and togetherness must come true if you want to make our mark in history. We look forward to continue to collaborate with all of you, including basic needs, NGOs, mental health authority, the private sector, the media, and all well-meaning persons to promote a healthy population towards national development. Once again, congratulations to the authority for this policy. Thank you, and God bless you all.
Thank you very much, Dr. Samuel Kaba. And I think you all will agree with me that, yes, you usually don't get short things from giants, do you? So we will consider that a short message. Thank you very much. And before I call up the next party to give us a solidarity message, I want to acknowledge the presence of some NGOs in mental health who have been with us from probably since I've been in mental health. I've known them, we've worked around with them. Mind Freedom is represented here this morning, and we are grateful to have you here. Please give us a wave if you have, if we have a, there we go. And then MESOC is also very well represented here. MESOC, let's see representative from MESOC. Thank you so much. So talking about NGOs in mental health, I think this will be an appropriate time to call on a representative of NGOs in mental health, and he is coming from Basic Needs Ghana, Mr. Sunday Anaba. Sorry, Sunday Anaba. Please welcome him with a clap. Yes, it's a long journey from the back there. So.
Okay, good morning. Madam Chair, representative of the Ministry of Health, the Chief Executive Officer of Mental Health Authority, directors, representative from FCDO, directors of the Mental Health Authority, colleagues, NGO members here, all other protocol duly observed. It's a great pleasure to be here representing NGOs who work in mental health, and then on behalf of my boss, Mr. Yaro, who would have been here. In fact, the launch of this policy couldn't have come at a better time, especially at the time that the coronavirus pandemic has actually worsened mental health challenges in the country. We, as an NGO in the past, have actually stepped in to support in complementing the efforts of government with support from DFID, which is now FCDO, by supporting direct service provision in the communities, including specialist psychiatric outreach clinics, including training of nurses to augment the number of mental health nurses, and also supporting people with lived experiences in the communities through the self-help groups. These are things that we have done in the past, and we have actually advocated for more funding in mental health, and also advocated for community level integration as to what was actually existing, known as the specialized services in the psychiatric hospitals. The drafting of this policy actually brought together a wide range of stakeholders in the past, including mental health NGOs. And when you look at this policy, you realize that issues of community reintegration and community service delivery has been highlighted, which is why the policy is something that stakeholders in the mental health front are actually embracing it. It also takes into consideration issues of human rights. As you can see, as NGO partners working in the mental health, we have been collaborating with the Mental Health Authority to support in implementing the quality rights projects, which is being led by the WHO as something that will help people with mental illness understand their rights and be able to claim their rights in the communities. However, the funding issue is still the challenge. And as we are launching this, we are appealing to government and then other bodies to ensure that at least the policy comes along with some form of funding. We are hoping that at the end of the day, if the policy is passed and there's funding committed to the Mental Health Authority, a lot of what's the name, committees that were not set up will actually come into play. The visiting committee, the tribunals, and then even the district level committees that are yet to be set up will set up to help us implement the Mental Health Act effectively. As we are here, we are hoping that in the near future, mental health will not be talked of as an issue that is separated from general health. We are hoping that we will ensure that we have a mental health population by churning out this policy, and then we can all have a mentally healthy population in the future. Thank you.
Thank you very much, sir. Thank you so much. And we appreciate all the effort and the dedication that you've put in helping mental health population in the country, people with mental health conditions, particularly in deprived areas. And Basic Needs has done a lot of work in that area, and we want to appreciate them for that. And let me at this time ask that we will applaud the team that has put this program together, please. The team from SomubieDwumadie and then the Mental Health Authority, Vivian Fisher. Vivian Fisher is with SomubieDwumadie Ghana. She has helped put together this program. Mr. Franklin Safo of the PPME Department of the Mental Health Authority, the Director of Administration of the Mental Health Authority, Mr. Victor Spesase. They have all done a lot of work in putting this program together. Please show some appreciation for the beautiful work we have done. Thank you very much. Thank you. And to conclude our solidarity messages, I want to call on the very people who have made this possible. A representative from Ghana SomubieDwumadie, Laila Adwan, to give us a short solidarity message. Please welcome her with a clap. Oh, I'm not hearing that. I'm not hearing it. Thank you very much. Thank you. Thank you.
Thank you very much. Chief Director, Madam Chair, members of the High Table, I stand on all other protocols. Ghana SomubieDwumadie is honored to be here today on the occasion of the launch of the mental health policy, and happy to have worked alongside Mental Health Authority and provided some small support to enable today's launch to take place. My name is Laila Adwan Kamara, and I'm team leader on Ghana SomubieDwumadie Ghana Participation Program. This is a 4-year disability program in Ghana with a specific focus on mental health. The program is funded with UK aid from the UK government. And the program is run by an options-led consortium, which also consists of Basic Needs Ghana, who you've just heard from, King's College London, Side Savers International, and Tropical Health. Since the start of our program in January 2020, we've worked closely with colleagues from the Mental Health Authority on some of the key issues identified in the mental health policy. This has included working with Ministry of Health, MHA, and other stakeholders such as the Ghana Health Service and NHIS to develop a compelling case for more investment in mental health. This is a key requirement of the mental health policy, and I'm simply echoing what others have said today already. This investment, this need for investment has become ever more critical as we see that the impact of COVID-19 is not just physical, but also affects people's mental health too. Some of our other areas of work in close partnership with the Mental Health Authority are also in fulfillment of the policy, including working together on the establishment of the Mental Health Review Tribunal and the regional mental health visiting committees in key areas. Both of these have critical human rights functions and are required by the Mental Health Act 2012. Equally, we are working closely with MHA to reinvigorate regional mental health subcommittees in selected regions, in addition to district-level mental health planning support. I hope this gives a flavor of our close working relationship. We're doing more together than I've had time to mention, and I wish we could do more still. Issues of mental health remain critical in Ghana today. At Ghana SomubieDwumadie, we wholeheartedly support today's launch of the mental health policy, and we look forward to continuing to work alongside colleagues at MHA and also Ghana Health Service and Ministry of Health, along with other stakeholders, to support ongoing implementation of key aspects of the policy. Thank you.
Thank you very much, Laila Adwan Kamara. And this should bring us to that point where we get to know what this policy is about and what is contained in the policy. So if we're ready with our presentation here, I will want to call on the Chief Executive of the Mental Health Authority, Prof. Akwesi Osei, to give us an overview of this mental health policy that we launched today. Professor, please, and let's go.
Thank you very much, Kwaku. Madam Chair, Chief Director representing the Honorable Minister, Madam Susan, all protocol observed. Thank you very much for being here this morning to help us to launch this program, this policy. The policy has been drawn for some time. We've actually even started implementing, but it needs to be outdoor, it needs to be launched, and today is just a day for us. So responding. Good. So you'll just go through a short background and scope of the authority and the history of the policy, or history of policy development in Ghana, and this particular one, and the objective and scope of the policy, and what problem are we trying to address, and the national and legal context of the policy, the guiding principles, and the rationale for the policy, and the implementation framework, and the development process, and the implementation framework, and then a few concluding remarks. So the Mental Health Authority was established as an agency of the Ministry of Health, indeed one of the 23 or so agencies in the ministry, and that was in 2012 when the Act, Mental Health Act, 8 forces of 2012 was passed with the twin mandates. Indeed, all agencies have one mandate, one particular mandate, but we have 2 mandates. The other agencies, either you are a regulatory, you are a service delivery, you are a research, you are a training institution, we have twin mandates: implementation or service delivery and regulation. We propose and ensure the implementation of mental health policies, protocols, and guidelines, and the service delivery is through psychiatric hospitals. We said twin mandates of service delivery and regulation. So the service delivery is through the psychiatric hospitals directly and indirectly through collaboration with other agencies. And other activities are through regional and district mental health coordinators. The policy development generally, this is a 12-year policy, and it's the third that is being developed. As it was mentioned in the welcome address, the first was in 94, modified or updated in 96, and this is the current one. And it represents the first policy of the Ministry of Health since the Mental Health Authority came into existence. And we find it very significant. The objective, the purpose of the policy is to provide a framework for supporting achievement of good mental health for people living in Ghana, all persons living in Ghana, while being sensitive to culture, resources, geography, amongst other considerations. And indeed, the cultural component of it is really what makes it a toast of the world as a best example to be followed elsewhere, everywhere. So it's a culture sensitive. The policy covers promotion of mental health and, very important, prevention and management of mental health conditions for all persons across the lifespan. In other words, we recognize old age, geriatrics, we recognize middle age, we recognize adolescents, childhood, and in fact, even infants. Infants also have their mental health issues, very important. So let's not only think that adults have mental health issues. Indeed, once in a while, when you hear a 9-year-old person has committed or has taken his or her life, then you wonder, how come 9 years, what do you know? They have their problems, and the policy addresses all that. It covers substance use disorders, and not only cocaine, heroin, but even prescribed substances that people get addicted. Diazepam, Mobilium, Phenobarbital, pethidine, and others. It covers them all, but it does not include conditions that are purely neurological, even though sometimes there's a overlap, like dementia, is neurological and has mental health component. Epilepsy is neurological, but it has mental or behavior issues. We collaborate. And so that is where we are, that's the scope of the policy. So what problem are we trying to address? Despite the commendable efforts to improve mental health care, there still remains serious challenges. Challenges of stigma, challenges of discrimination, challenges of marginalization, challenges of non-inclusiveness, inadequate resources being given. These are real issues that we need to recognize. Lots of superstition, which brings about the stigma, discrimination. Somebody has mental illness and thinks that the witches after me. These are real issues, and it therefore becomes important that we fashion out a policy to address it. Staff attitude being poor. Why is staff attitude? And I'm glad the Ghana Health Service Director General's representative listed issues which are commonplace daily phenomena, and you will not think they are mental issues. Couples are struggling, they are quarreling every day, you don't understand. These are all mental health issues. Every now and then you hear of homicide, you hear of suicide, you hear of these things. Is there an underlying mental health? And there is, okay. So these are issues that the policy addresses. The national and legal context of the policy hinges on the 1992, it draws its strength from the 1992 Constitution, Article 15, and indeed a whole section on human rights. Mental health deals with it. So there is no health without mental health, and there's no right if there's no health. So health is a right, and mental health is also a right. It draws its strength from that. There are other articles in the Constitution. The Ghana's medium-term development policy, agenda for creating jobs, creating prosperity and equal opportunities. You can't create prosperity if you are not healthy, and you can't claim you are healthy if you are not mentally healthy. And that is the link. So if you want to create prosperity, you certainly should create health. You should also create mental health. You should be interested in our mental health. If you want to give equal opportunities, mental health cannot be marginalized. So all these are issues from which the policy draws its strength. Then an act of parliament, the Mental Health Act, is, so to speak, the mother or the immediate legal backing for the policy. And we know the act replaced NRCD Act of 1972, and many years before then, the 1880 Asylum Ordinance. So these are the areas, the legal and national context, that the policy draws strength. The tenets and vision envisaged in Act 846 as the governing law of mental service in the country inform the policy. As the chairperson said earlier, policy, law, which one counts, whichever way, once you have a law to back the policy or the policy to draw its strength from the law, we are on course, and that is where we are now. So there are guiding principles within the policy. If you take the policy, we want these guiding principles to cut through or across our health service delivery institutions. Evidence, it should be evidence-based. So we talk about evidence-based practice, and worldwide, we talk about decentralization. Mental health should not just be limited to one place, as it had been some time back. We talk about mental health care, somebody requiring serious mental health or care for serious mental health issue, and it means take the person to Accra, Ankara, Pantan. I remember those days when I was at Ankara, and people would come all the way from Tatale, Zamzungu, Boko to bring patients to Ankara. I came to Accra, same thing. Why can't we have similar services spread nationwide? The policy addresses it, and that is going to be implemented. It talks about integration of mental health services, and I'll talk about some of these in due course. So we should not have a situation where somebody sees anybody behaving strangely, or a doctor sees anybody behaving strangely and says abnormal behavior, psychosis, sent to a psychiatric hospital. Meanwhile, for you care is a general condition people have attended to. So we want to integrate our services. We are seeing a number of cases of meningitis being referred because the prescriber won't touch. The strange behavior makes me think it's a mental issue. But with the integration, you recognize that no. We are talking about holistic care. The care must be total, holistic. And so in our slogan, we say mental health, total health. These are issues. Then equity. Everybody should be given his due attention that he requires. Once the health condition requires this attention, irrespective of his circumstances, where he's coming from, his background, he should be given the due attention. And affordability. Mental health thrives on the basis that we know in practice that persons with mental health are among the poorest in the society. Can we say because they are not capable of paying for their services, they should not be given the care they need? No. So affordability issues are also highlighted in the policy. Human rights, in fact, this is probably the strongest point of the policy, drawing its strength from the law. Human rights issue. Everybody deserves to be treated with all dignity, because you are born with your inalienable rights that nobody can take away from. You should be interested in protecting and fulfilling, making sure that you get it, that we can't take it away from you. The empowerment. People with mental health problems should be empowered to assess themselves and to assess their health needs. Partnerships, we can't do it alone. We need everybody to be on board. And I'm happy we have a number of NGOs and other ministries, agencies, and private organizations. We should build partnerships. And in fact, users themselves are amongst our greatest allies. So with the partnerships, then we'll be able to get away. So the policy looks at all this. And then confidentiality. Information about you is to you and for you. We cannot go beyond you and spread it. Unless, of course, the law demands it or some circumstances requires that we breach that code of confidentiality. Otherwise, these are areas that the policy respects. The rationale for the policy, mental health conditions reduce life expectancy on the average by 10 to 20 years. Mental illness will not necessarily kill you, but it will set up the environment and conditions, enabling conditions for you to die earlier. So statistically, we know that people with mental health, on the average, they die 10 to 20 years earlier than everybody else. Typical example, you have depression. As a result of depression, you take your life. It's not a depression per se that killed you, but a depression set you up to take your life. You died earlier than you would have. Or because you have depression, you are so morose, you are so inactive, you can't even go and take your medicine for diabetes. You don't even have the awareness that you need to go and take a medicine for diabetes, or even to go and follow up to the hospital for your diabetes, and then the diabetes kills you. It's not a depression that killed you, diabetes, but the mental illness, the depression, set up the stage for your diabetes to kill you. So on the average, these are mental illness, people with mental illness, their life expectancy is reduced by 10 to 20 years. Mental health policy, the policy and the action plans, they coordinate through a common vision, programs and services related to mental health. So there is a coordination, a synergy in the areas you mentioned and what you want to see. There is a need to develop a new policy in the light of all that you said. The old policy did not do adequate justice in the sense of where we are now. And this is today, things have changed. So there was a need to develop a new policy to take into consideration all these issues we've mentioned, especially with respect to human rights. Good mental health contributes positively to physical health. You mentioned, and one of my coordinators in the past said, people with guinea worms, he can't go to work. How can he be rich? Because he has a guinea worm, he can't go to work, and he's poor. Somebody else without it, he's getting money, and you don't understand. You think he is lazy. No, because of the mental illness, he cannot attend to the guinea worm, and therefore. So these are real issues. So if you are able to address mental health, you contribute positively to your physical health, your family life, education, social participation, inclusiveness, and economic development. Mental health conditions worsen the health outcomes of both communicable and non-communicable diseases. Indeed, with the COVID, it's come up as one of the things. People with mental illness are more likely to be symptomatic when they have COVID. Recent studies. So mental illness predisposes you to various other conditions where you could have been more resilient we could have been stronger to withstand any adverse condition that comes along. Mental illness is already a lot of stress. You know the effect that stress is. Mental health conditions are a significant contributor to mortality through premature deaths from physical disorders, and this I've explained. Then at the national level, we also will need to understand that mental illness causes poverty of the country in one way or the other. A study in 2009 in Ghana showed that persons with mental illness contribute to 7% GDP loss of the country. 7% of GDP loss of the country. Currently, we are struggling with, I think with the COVID, we are struggling probably by the end of the year, we will be probably making about 4%. Normal times, about 7% GDP. And we are losing 7% as a result of persons with mental illness. They can't go to work, productivity goes down. Somebody with malaria walks to the hospital alone. Somebody with mental illness will be accompanied by 5, 10 people. They all can't go to work. There was a time I counted the number of people who accompanied a person with depression, and there were 20, you can't believe, 20 people. They were dependent on him, actually. Now 20 people. It means that the 20 people did not go to work. Imagine productivity loss. So if you look at all the productivity loss as a result of directly the illness, as a result of people who are accompanying him, as a whole lot of things, we lose 7% of our GDP. So if we address our mental health issues, we are increasing our GDP by 7%. Add it to our 7% daily annually, and we have 14%. You would have been reaching a middle income country, not just low middle income country, but upper middle income and then first class country. It's therefore important for us to recognize that mental illness will drain you as an individual, your pocket individual, and as a nation without our recognizing it, before you realize it's too far. Mental health conditions are a significant, we're a contributor to mortality. So this we mentioned. Now, the policy development processes, what did we go through to come where we are? We've mentioned that we had our last policy in 1996. And when the new board came into effect, the first actually, as a result of the passage of the law, then the board decided that we needed a policy. We needed to review or revise the old policy we had. So 2016, the old board commissioned the review of the mental health policy, and with the support of then DFID, now FCDO, steps were taken. FCDO provided technical support through Oxford Policy Management who came in UK, together with local collaborators for a policy to be developed. Eventually, we took it up ourselves and continued. A team of international and local consultants were engaged, and eventually local consultants, we continued it, and we had this. Now the team interviewed the sector minister, key staff of the Ministry of Health, ministers for gender, children and social protection, minister for justice and attorney general, minister for finance, key staff, professional groups across the nation, traditional healers, users. And I clearly remember one of the traditional healers who always will hold our neck that why are you developing this policy without our involvement? So we made sure that they were all involved, not just for all this, just for the fun of it, but really they have an input to give. And if we don't bring them in, we are leaving ourselves. So traditional healers, users, non-governmental organizations, NGOs, Ghana Health Service, Christian Health Association of Ghana, teaching, psychiatric, regional district hospitals, a host of stakeholders. We all contributed views at different levels, and eventually we had what we went through. We had an objective appraisal of the current state of mental health service was produced from the stakeholder consultations. Policy drafts went through a number of sessions from the PPME, Ministry of Health. We went through National Development Planning Commission, with whom we sat for about 3 or 4 times to eventually get a final document. The minister himself directly also made relevant changes until we had what we have. By the policy initially, we started 2016. So we're having a 7-year policy from 2017 to 2024. And then as it got delayed, we also increased the length of time. And then we realized that the Minister of Health itself was developing a policy that was to last till 2030. So we did it align. So by the time we got ready, 2019 to 2030. So by 2019, it was ready and we started using, but the launching got a little delayed. Until, thank God, SomubieDwumadie came together and we now are where we are. So various ministries, planning, monitoring, evaluation, human rights and good governance, finance, were all involved. Now, organizations responsible for advocacy and community engagement, the implementation framework, as we have said earlier, that is not one, it's not a policy for actually the mental health authority alone. It's a policy for the Ministry of Health and indeed policy for Ghana. So various stakeholders going beyond even the Ministry of Health are all involved for us to be able to implement. So development partners, community, civil society, or everybody is involved for the implementation. Now, what is the thrust of the policy itself? We are talking about integration of mental health into general health care. And since we started implementing, thank God, we've gone quite a distance of this. So you go to the teaching hospitals of the 10, the regional hospitals of the 10 regions. 3 had established, and the Ghana Health Service, they are here. 3 had well-established psychiatric wings. 7 others, okay, 4 of the others also had units which were functioning as wings. Only 3 didn't have, and we are taking steps together. Now with 16 new regions, 6 new regions added, all the 16, we are collaborating with Ghana Health Service to make sure that all the regional hospitals, both old and new, everybody has a psychiatric wing. So patients will be seen where they are, and if you do that way, only very few will require referral to this currently standalone psychiatric hospitals. You go beyond that, all district hospitals will also have psychiatric units. So they will see patients, they will not have psychiatric wings with, let's say, 10, 20 beds, but within the hospitals, you will have dedicated beds. We call it the virtual beds. If there's no patient, no problem, it can be used by other patients. But if there's a patient and they've got to the limit of the number given them, this is 5 beds per district, until you see 5 patients at district hospital, you can't say there's no bed when there actually is a bed somewhere. So virtual bed. So patients can be seen at the districts from health center, a CHIPS zone health center to district hospital, they can be seen there. And if it's not working after maybe a week or 2, then they may be referred to the regional hospital psychiatric wing. If it does not work, it is there that they will be referred to after. If you do it that way, very few people will require referral to its main psychiatric hospital. So integration is very key. Then community-oriented care. Again, we are de-emphasizing centralized care so that mental health care will not just be Accra and Kafo Pantan, but indeed, thank God, with the Agenda 111, which in the welcome address it was mentioned, we have 2 new psychiatric hospitals going to be built within the middle belt and within the northern belt, so that anybody from Zamzibu Tatali will not need to come to Ankapo, but can be seen at Tamale, or anybody from within the center belt, PA, Ashanti, will be seen at the psychiatric hospital in the middle belt. And these are state-of-the-art facilities that are going to be built. And that will be helping with the decentralization of mental health care. So that's very important. We want to de-emphasize institutional care. By institutional care, we mean where a situation where somebody is admitted to the hospital and more or less forgotten. Admitted to the psychiatric hospital and more or less forgotten. No. With the current approach, you go to a psychiatric hospital, just as you go to Kolebu, you can't make Kolebu your home. You can't make which hospital your home. You are going for treatment, maximum 1 week, 2 weeks, and where you go home. In the same way, you are admitted to a psychiatric hospital. You should be well within 2 weeks and go home. Some can go home the same day, others the next day, but it does not become your home. So you don't get that what we call institutional neurosis. So that's very important. Mental health promotion is very important. We are ensuring that we are promoting mental health. People should recognize what is it to stay mentally healthy? What is it if you are beginning to develop some mental illness, how to recognize it very early and to get intervention so that you can be healthy? This will help to reduce stigma and discrimination. So mental health promotion is a very important component thrust of the policy. And the human resource training and development. We need to train more people. Now we talked about 2 new hospitals. And by the way, Accra Psychiatric Hospital is also going to be redeveloped to have a new face, not what we see, the 100-year-old hospital we see. So all this will require more human resources. So we need to train more people, and the policy is on that. It has a trust for that. Human rights, and I've mentioned that a lot. So mental health funding, that's also very important. The policy wants to make sure that mental health is adequately funded, and it reinforces what is in the law as mental health fund to be established. When the fund is established, we have money to do all that requires to be done. We said mental health care is supposed to be free. In practice, it's not free because we are not having the funding to support the free care. But the policy will make sure that it becomes truly free because we have the funding coming to support it. So these are the issues that the policy is looking at. And all this is elaborated so that you take it, everybody has a role to play. SHAP has a role to play, teaching hospitals have a role to play, Ghana Health Service, everybody. And indeed, one area that the policy also emphasizes, in line with the law, is that even traditional healers, faith-based healers, have a role. So the policy recognizes them as frontline community mental health workers, informal community mental health workers, because they are there in the community and they're the people anybody with mental health issue will see first before they come. And so we are not going to ban them, we are not banning them, but we are recognizing them as veritable stakeholders and train them for them to be able to deliver what they can deliver and recognize what they cannot deliver and refer. So these are the areas that the policy trusts and is elaborated a lot. So in concluding, I want to say the policy development, the publication and its launch has been the involvement of all stakeholders, and their support must continue to ensure its successful implementation to achieve its intended goals and objectives. So 2019 to 2030, by the time we get to 2025, we trust that these issues should have been effectively implemented and mental health will get a totally new image, and you can feel free and walk into any facility and say that I have mental health issue. Can you help in that with them? We want to thank you very much. So in acknowledgement, and it's not a exhaustive list, we want to thank the Minister of Health, particularly the Minister for Health, the current Chief Director and the immediate past Chief Director. They were very helpful, all the steps of the policy development and the launch. We are very grateful to them. So Honorable Chief, thank you very, very much. And then the Foreign Commonwealth and Development Office, FCDO, former BFID, we thank them very much. They supported in a lot of ways in the development. And the NDPC, National Development Planning Commission, they fine-tune various areas and make sure that it conforms to the national policy development agenda. Ghana Health Service, CHAG, and all various NGOs, we really appreciate as they collaborate. And then Ghana SomubieDwumadie options, we thank you very much. So that is what we have.
Ladies and gentlemen, let's do it again for the Chief Executive of the Mental Health Authority. Thank you so much, Prof. Akwesiose. And I want to believe that with this, we have a very good idea what is contained in this mental health policy. And I will demand an honest answer from you, ladies and gentlemen. Do you think it's a good thing? Do you think it's a good thing? All right, and that's why we are all going to commit to it. Thank you very, very much. And to get us to towards the end of this program, I think this is an appropriate time to call on what we call the landlords, I mean, basically the Ministry of Health, and definitely the representative of the Minister for Health, Mr. Kwabena Buedu Oku Afari, and he is the Chief Director of the Ministry of Health of Ghana, and he will give us a keynote address and then launch this beautiful, beautiful policy we have here. So, please welcome him. Thank you.
Thank you very much, MC Kweku Asenso Broly. Madam Chairperson, the Chief Executive Officer of the Mental Health Authority, all the directors and staff of the authority, invited guests, development partners, ladies and gentlemen of the press, and all friends and gentlemen and ladies of mental health fraternity. I am here on behalf of the Honorable Minister for Health, Honorable Kweku Ajimangmenu, the MP for Doma Central, who had actually penciled to come in here. But as I always indicate, that the sort of work that we are doing is like we are in a military barracks. We are so regimented that any time that you are called, you have to stop whatever thing you are doing and move. Just as I was called and I had to stop, truncate everything and come. So he says I should extend his apologies to you for not being able to come here himself. This time round, not because he does not cherish mental health issues, but because the circumstances are such that he cannot be here himself. So I'm going to read his keynote address on his behalf. I'm very happy to be part of this historic event, the launch of the 12 years mental health policy for Ghana. It is historic, not only because it is the first of its kind under the newly created agency of the Mental Health Authority of the Ministry of Health, but also because the prevailing COVID-19 pandemic has brought on board heightened issues of mental health and well-being of Ghanaians. Today's event and the subsequent days beyond should see us and set us on the path to improving the way we view and deliver mental health service in our country. Over the years, I've come to acknowledge the plethora of problems that mental health has been facing in the nation. These include recurrent problems of underfinancing, underfunding of mental health issues, discrimination and stigmatization against mental health staff and patients, inadequate human resource, the relative lack of interest of individuals coming into mental health as profession, and the fact that mental health has been ignored by both policymakers, the civil society, and in fact, everybody in our nation. The development of the first mental health policy for Ghana was in 1994, and it was reviewed in 1996. Subsequently, there has been a global change in the health sector landscape, and this has had a positive impact on Ghana and the world at large. Admittedly, some progress has since been made in the delivery of mental health services in the country, although many challenges still persist. This policy was developed with these problems in mind, to provide a framework to mitigate the challenges facing the provision of mental health services in the country and forge ahead for an improved service delivery. It should be mentioned here that the United Nations Sustainable Development Goals, SDGs, have aptly widened health beyond physical health to mental and social well-being. Thus, the attainment of the health-related SDG goals cannot and must not be alienated from mental and social well-being of Ghanaians. Consequently, any effort by government, the Ministry of Health, international development partners, civil society organizations, corporate Ghana, and individuals will go many, many miles to ensure that the vision of ensuring a mentally healthy population for all living in Ghana is achieved. Invited guests, ladies and gentlemen, the realization of the above stated vision of mental health authority calls for the reorientation as Ghanaians about mental health and ability to invest into the sector, much as this government has improved upon the budgetary allocations to the agency. It is still not enough. We will acknowledge that of late, funding to the mental health authority has been ring-fenced in such a way that no matter how small budgetary allocations are, they have their share at least ring-fenced and allocated to them. It is still not the best, though, but the statutory provision that mental health conditions shall not be paid for by those in need of them is still maintained. Indeed, we are making efforts to ensure that a dedicated fund financed predominantly from a mental health levy is established. This, we believe, will enable a successful implementation of this policy. I must say that I'm impressed with the successes that the Mental Health Authority has so far chalked regardless of the challenges that they are facing, particularly in terms of human resource and financing challenges. And they've endured as a relatively young agency. The Mental Health Authority, upholding its mission of promoting mental health, prevent mental illness, and provide accessible, community-oriented, integrated, quality, and culturally appropriate mental health care to persons with mental illness has over the years strived to ensure that persons with mental illness can access care in almost all communities in Ghana. As the Minister of Health seeks to ensure that quality and affordability in terms of healthcare is made accessible to all throughout the country, it is heartwarming to know that the Mental Health Authority is carrying out its mandate diligently in spite of the constraints. I would like to commend all mental health professionals for having weathered the storm and moved mental health forward, even under such trying circumstances. I thank each and every one of you for the selfless commitment you have shown and continue to show to our brothers and sisters suffering from mental illness. I would like to assure you that the Minister of Health is doing everything feasible to assist and collaborate with you in ensuring that mental health care is available and accessible to everyone in our society. On behalf of the President of the Republic and on behalf of the Minister of Health, I would like to thank all development partners and all other stakeholders. I would not want to mention names because if I'm not careful, I'll leave some out and create disaffection. But we know all of you. We recognize all of you. We appreciate all of you who have helped in the development of the policy. And your continued support of mental health is very much appreciated. We appreciate all the significant contributions that you have made in mental health services and implore you to keep investing and supporting the sector, because the government alone cannot do everything. Madam Chairperson, invited guests, Chief Executive of the Mental Health Authority and directors, ladies and gentlemen, representatives of the media, and all present, the policy of our mental health is duly launched today. I invite the Chief Executive to join. Thank you. Thank you very much.
Ladies and gentlemen, let's do it one more time for Mr. Untitled Chapter, the Chief Director, the Ministry of Health. Thank you so much. So with our policy finally launched, I think I can assure each and everyone here that you are going to go away with a copy of this document. I hope I haven't promised too much. Wonderful, thank you so much. Yes, so that's for the minister. Thank you so much. Okay, yeah, so do take your seats. You will be given a copy of the mental health policy. And thank you, Chief Director. We really appreciate your time and effort. Thanks so much. I guess this will be an appropriate time. And with the media, please, I want to ask you to hold on with the interviews and others. We will find an appropriate time to do that. And we want to do that in groups. So this program is going to end very soon. So please don't be in a hurry to go away. Just hold on. Let's get it done in groups. We'll have a Chi session, an English session. So don't be in a hurry to go away. Can I at this time call on the chairperson of, yes, on the chairperson for this occasion to give us her closing remarks, please. So Madam Esther Lapierre, thank you so much.
Thank you, Ms. Ruby. Representative of the Minister for Health, other members of the High Table, distinguished ladies and gentlemen. The mental health policy has been launched, and I'm so pleased that this event has taken place and that we now have a policy to fully implement the 2012 Mental Health Act. It's hard to believe it's 9 years since the Mental Health Act was enacted. But nevertheless, we are moving forward. I started in my opening remarks by making reference to what a policy should seek to achieve. Well, I think you've heard it all. I thought the Chief Executive did an excellent overview of the policy and what it includes. We must now take it to the next level. There is no point in having a document that looks attractive and is comprehensive, but is not used. This mental health policy should not decorate offices, hospitals, consulting rooms. It must be used. It covers every facet of mental health. And I really would urge all the stakeholders to make sure that it is effectively referred to. The policy must be resourced. It will not go anywhere if it doesn't have the adequate human resource required to roll it out. And it will not go anywhere if it doesn't have adequate finances to support it. Reference has been made to the Mental Health Fund. We are also aware that the Mental Health Fund was established by the 2012 Mental Health Act. We need to get that fund up and running. As it is, I stand to be corrected, it has not been fully established. So the policy will not work if it is not adequately funded. The policy must be monitored. We live in a dynamic society. The world is changing. The last 12 months alone has given us insight into how rapidly the world can change. So this policy must be monitored so that it remains responsive to the needs of people with mental disorder in this country. The policy must be evaluated frequently so that it is kept current. The policy must be reformulated. I didn't hear a reference to when that is likely to be done, but we know that it is for a particular period up until, I believe, did I hear 2030? But during that period, it will need to be updated, just as the 1996 policy was reviewed and updated periodically. To end, I'd like to say that from what I've heard today and all the presentations so far, I feel very, very, very confident that we have a mental health policy that will indeed ensure a mentally healthy population. Thank you very much.
Thank you so much, Madam Chair. And I believe that all of us here in this room do share in that confidence of hers. Right, I think it's just about time that we say our thank yous and then get out of here, because we do not want to be in an enclosure for a very long time. We indicated initially that COVID is still with us. So I will at this time want to call on the acting head, quality and rights at the Mental Health Authority. She did us the honors of saying an opening prayer for us. And she'll once again do us the honors of thanking all our guests here for being with us at this August occasion. So I want to call on Mrs. Akofa Akpanya-Hulobo once again, ESPA, to give us a vote of thanks. Please, let's welcome her with the clap. Thank you. Thank you. ESPA.
Madam Chair, members of the high table, all protocols observed. Indeed, mental health has come a long way. And looking at the presentation by our Chief Executive, the future of mental health looks good. So we want to thank the Almighty God for leading us through this program to a successful end. Thank you very much, our chairperson, for steering the affairs of this function perfectly. Very effective and efficient, chairperson. Thank you very much for your interest in mental health and for your support. We thank you, our representative of the minister. Thank you very much for pledging your support and also for pledging action following that support. We acknowledge the fact that you have realized that it's time for the mental health levy to come into being. We are very, very grateful to you, the ministry and government, for what you are doing for mental health and what you continue to do. We thank you, Mental Health Authority, for taking action and pledging your support. We all have a role to play in this policy. And as the chairperson rightly said, it shouldn't be a decorative tool on our tables. It should be a guiding principle for our work in mental health. Thank you very much, the ministry, agencies, and departments for being part of this program. Thank you, NGOs. Thank you all for coming. Thank you.
And I think, yes, a very big thank you to you two for thanking us. Thanks so much. And we also want to appreciate Clement here, who has been helping us with the sign language. Please give him a round of applause. He's been excellent. And we also want to appreciate all participants, all those who joined us on Zoom, those who joined us online. With quite a good number there. We really appreciate your time being with us, and we appreciate all the feedback that you gave to us. Thank you all very much once again. And I think this brings us to the end of this program. I believe everyone has a copy of the policy. And since we began with the prayer, perhaps we'll end with one. And since I see no cleric around here, perhaps I'll do that myself. As an aspiring Reverend Minister myself, I perhaps will do this. And I want to say that we thank God for bringing us to the end of this session. And we ask that He will lead us and guide us back to our various places, our various destinations. In the name of His Son, Jesus Christ, we pray. Amen. Thank you all very, very much. We appreciate it. Thank you. I want to believe refreshments and other things we've received them, right? Yes. Thank you. And for the media, please. And please, these policies are meant for places of work and not our homes, please. They are meant for our offices and not our homes. So keep them in the offices and not in the house. Yeah, so for our media friends, those of you who would want to take an interview with the chief executive, we want to do that here now. We're doing one in English, we're doing one in Chi. So please, this is the time to come up here. We'll do one in English and one in Chi.